Well, welcome everyone. Actually, probably should share my screen to just bring up our usual. Oh, you got to give me access, Paul. Why don't you at some point let me share my screen and I'll pull up the slides. But welcome to Surgeon Wellness during COVID-19, our community focus group, where we're trying to get perspectives from multiple different people, multiple people that totally understand the medical world, the healthcare world, and realize that there's an opportunity for wellness for all physicians, and particularly with perhaps our niche, which is the surgeon wellness. I'm looking forward to having several of our panelists share some of their perspectives. And but we also want to recognize anyone in attendance that wants to share something as well. We'll encourage you to participate in the chat, encourage you to raise your hand if you want to stay off the panel but want to maybe be promoted briefly. Let us know. Paul's the technician and will help us coordinate those things. But I like to have a lot of flexibility so people are in the most comfortable space that they'd like to be. I think Paul did launch another poll. We're just trying to make sure that we're addressing a diverse group with diverse specialties. Obviously, I bring a lot of my friends along who are orthopedic trauma surgeons or orthopedic surgeons, but I think we're doing a really good job diversifying in those areas. Gosh, let me go ahead and introduce some of the folks on the panel. Let me see if I can get my poll out of the way. So we have Dr. Gregory Brown. Greg, why don't you say hi?
Hello.
And for anyone who might be new with us, why don't you go ahead and give us a little brief introduction? Although, I don't know, like, I've seen you a lot over the last couple of months. You look like, I don't know, like fresh haircut, shaved. I'm not sure, like, what's going on there?
You're correct on the shave. I was at home for 2 months and I didn't shave. The haircut's no different. I had planned to be in Japan for 2 months, so I pretty much shaved my head before I left. So I have survived the no barber shops being open for the COVID crisis. So this is what you get after 2 months of having your head shaved. So your earlier answer is for question. I'm an orthopedic surgeon. I'm currently practicing in Williston, North Dakota. It's a 25-bed critical access hospital. Cover call when I'm here full time and also do some elective stuff while I'm from clinic. So,
excellent, welcome. And we also have Dr. Susan Wilson with us. And Susan could be in one of two locations, but I'm going to go for the Midwest at the moment.
Good guess, actually. That's great. So I am a retired emergency medicine physician, and I do now spend 6 months of the year in California. So I was up until a couple of weeks ago in Carlsbad, and now for the summer, I am in northern Wisconsin in a very nice remote area. So yes, I'm now in Wisconsin.
Excellent. And then will it continue to be kind of the snowbird concept, or?
Yeah, I think so. I'm going to be here through the end of October and then come back out to Carlsbad and be there again until probably the beginning of May next year. So yeah, it's a good mix.
Well, we'll have to meet up for coffee when you're that close by next time.
Yes, definitely.
And how often is your husband make it that way when he's not working?
Yeah, so my husband is also practicing emergency medicine. Right now he's doing actually more administrative work, but he still is commuting back and forth. So I would say he's down in Milwaukee maybe a week at a time, and then either in California or here in northern Wisconsin for the other 3 weeks. So he kind of bunches everything together in a week. So it works out pretty well.
Excellent. What's your current new side gig?
Oh, so my current new side gig is, thank you for reminding me. I'm actually practicing coaching full time. I just became certified as a physician peer coach. And so I'm now coaching people specifically with issues of job satisfaction and burnout, and then also doing some work with people with peer support. So helping them through crises just like this.
Excellent. So I'm here on the call, and so I might need to reach out myself a little bit. We'll see how I do through the call. And then we have Dr. Terry Malcolm. Terry, why don't you introduce yourself?
Hi, it's nice to meet everybody. And Jeff, thanks so much for inviting me to be a part of this discussion today and meet everybody that's on the call. So I'm Terry Malcolm. I'm in Scottsdale, Arizona. I am a board certified OBGYN who stepped away from clinical practice just a couple of years ago as I was moving into full-time administrative leadership. And I am now a full-time physician coach. I'm a certified physician development coach and founded my own coaching firm, Master Physician Leaders.
Excellent. So welcome everyone. Let's see, Paul, did you let me share my slides? Oh, and when I think ahead too much, sometimes let's see, what did I do? I had a PowerPoint. Why is it not showing up in let's try.
So I'll ask Terry a question while we're waiting. Do you miss clinical practice?
That is a great question that I do get quite often. And the answer is no, I don't miss clinical practice, because one of the things that I loved about clinical practice was the relationships with patients. And being a coach has filled that void for me. It's the relationship building that I love. I mean, yes, I loved being in the OR. I loved patient encounters. I loved busy days where I got to see patients, but at the end of the day, it was really the relationships that brought me back every day to see how the patients were doing, and especially to see patients over years and to see multiple generations in my clinic and in my practice. So I get to do that as a coach, and so it makes me not miss it.
No, Jeff's muted himself, so
Yeah.
forget the PowerPoint.
All right. I'm having trouble with my control panel. I'll recover here in a second, but I did want to also acknowledge that Terry invited me to one of the programs that she and with a duo coach put on a fantastic program on using improv techniques. And I really appreciate you letting me be, invited to that and experience that with you. That was an excellent job.
Oh, thank you. And you were great at just rolling with it too. I kind of just threw you in there, and you rolled with the punches. So thank you for improvising in the moment.
So let me see, exit minimal view. Would that work? Okay. So let me see if I can share now. And I still don't have a PowerPoint. I don't quite get that. So I'm going to go to my desktop, and hopefully I don't have anything too crazy in there. That's not the talk I want today. I haven't usually had that much difficulty with Zoom, so I don't know why I'm getting it today. But anyways, so we'll go through some of that. I just wanted to have some of these key talking points up for anyone like Terry new to visiting this focus group. We have tried to highlight a few different points that are great take-home messages or key points for people. And then we also have really had sort of a very broad definition of wellness from way back. I mean, I think people are still stressed out about bringing COVID-19 home to the family. But early on, I think that very significant issue. And I think people are figuring out how to minimize that risk. But we've covered all sorts of different topics that broadly touch on wellness. Anyone have something of particular relevance, something that they've learned over the last couple weeks or recently that they thought was particularly valuable to share with our audience?
Well, I can actually jump in. This was actually very interesting. I just listened to a lecture that was sponsored by ASAP, which is the American College of Emergency Physicians. And this was a lecture entitled Heroes Hurt Too. And it was done by a psychiatrist who specializes in emergency psychiatry. And the whole point of this lecture was speaking to us as healthcare professionals and how we are dealing with the stress. And this was specifically designed, for emergency physicians and how they're dealing with this stress of COVID. And so it clearly applies to any of us in healthcare. And so it was really interesting because a couple of the points that were brought up was that fear and danger are two different things. And I really think that we probably kind of forget that sometimes when we're trying to work and we realize, we can intellectualize the dangers of the disease and how it's affecting our practice, but then also we as human beings are also succumbing to the fear, just like the patients that we're taking care of. And so the whole point of recognizing that there's fear and danger as two different modalities, makes you then realize that your brain functions differently when you're afraid. And what was pointed out is that we oftentimes get distracted, we're impulsive, we're emotional, forgetful, error prone, I think was a really good point, because when you're fearful and you get more emotional, I think then you tend to make maybe more errors, or you forget things. And so it's really important to try to separate those two things as clinicians, and just kind of take a step back and recognize how the fear impacts us, professionally. So I thought that was a very interesting point.
What would you add to what was shared there? Like, so what are, first step being recognized and aware of it, like what would be your next steps?
Well, I think, so I think my personal next steps would be somehow being able to take a step back, sort of, in the coaching world, you talk about the meta view, like being up above and kind of looking down. And so I think if we as physicians can sort of take a step back from our environment and recognizing that we're fearful helps to get us back on track. And also in this lecture that I listened to was a whole mantra of coping skills for us in terms of being able to self-monitor yourself. So being able to recognize, and actually it's a kind of a cool acronym, it's I am safe. So it's IMSAFE, and what it stands for is I is illness. So recognizing if you go to work sick, that's probably not going to help you. It's not going to help your patients. The M stands for medication. If you started on some new medicine or something that might affect you at work as well. S is, of course, stress. So I think recognizing that we're under a lot of stress really helps people then to monitor their own ability to cope with the crisis. The A refers to alcohol and drugs. So I think, being honest with ourselves and recognizing, are we maybe drinking a little bit more? And, if you're drinking more at night and then you go to work the next day and you're hungover, that's going to impact how you feel at work. The F is fatigue. And I think all of us have been in situations where we're working so hard that we're just we're fatigued, we're tired, and then that also impacts on the quality of care we're providing. And then the E is actually, this was kind of interesting. He pointed out E was for eating and elimination, referring to, you know, now that we're in this, in the pandemic mode, everyone is doffing, you know, donning and doffing. And so there's so much more attention made to, you know, PPE, gowns, masks, everything. And so the whole concept of, you know, having to kind of fit into the schedule of your isolation masks and stuff, being still able to eat. And then, you know, obviously if you don't eat regularly, that also affects your mental function. And so I think being aware and self-monitoring ourselves really goes a long way to help us then, you know, cope, and then secondarily recognize if we are feeling fearful.
Excellent. Any one of our panelists have another question or comment related to what Susan shared?
Thanks, Susan. I'll just share a comment. I figured out a while ago how I self-treated myself, and that is I love to do Sudoku. So when you're emotionally hijacked and you know, all these internal voices and everything else going on, if you force yourself into your logical brain, you drive yourself out of that emotional, you know, crisis or emotional hijacking. And so
Right.
I realized that was part of the reason I think I was doing Sudoku. I enjoy it, but I think it was a way to self-medicate, if you will, on a very safe medication to just get you out of the stress and some of the internal voices and say, okay, I'm back.
Right. Oh, absolutely. Yeah. Yeah. And, you know, I think the other thing we need to recognize, there's a myriad of different coping skills that are pretty well recognized, you know, healthy eating, exercise, trying to have a normal schedule. And obviously all of those don't work for everyone, but I think we need to be able to identify, you know, what works for us personally. And I know for me personally, you know, when I'm stressed or I feel anxious about stuff, I mean, I like to work out a lot. And so regular exercise for me is so important. And the other thing I think that is really good is to try to look forward to something positive every day. I mean, you know, if it's reading a bedtime story to your child when you tuck them in at night, taking a nice hot bath when you get home from work. I mean, looking forward to something I think is so important, and I think is so therapeutic, and I think really helps to get through these kind of crises.
Excellent. Terry, you have a question or comment?
Yeah, I really appreciate what Susan is sharing, and it makes me think a lot about you know, kind of that pathway to wellness, and I think sometimes we're looking for the easy pathway because we want it now, or maybe it's just me, but you know, I want it right now, and I want it immediately. And you know, the easy changes are kind of like just downloading an app. It's easy to add, but it may add some value to you, but is that going to last forever? And so it's about focusing, I think, more on the harder changes, that harder pathway to wellness, that is very likely going to be more uncomfortable, but is going to lead to the lasting change. And so it is about looking, you know, it is really about confessing, what am I doing? What do I want to do? When do I do it? How do I want to do it? And being able to identify, like, what gains, what prizes are you getting from the behavior that's keeping you away from achieving wellness, and really making those short-term connections about what are the behaviors that I'm engaged in that might feel good in the moment, but are not leading me to lasting wellness or lasting fulfillment. And as well as, like, what are some of the punishments? So even though these things might feel good, what's also the price that I might be paying for by not doing these other things? Because with the behavior, there's going to be a reward, but then there is also going to be a potential cost of that. And so I think, it is really looking at both sides of that and weighing those to decide with all of that information to help you get to a stronger pathway of wellness. So I appreciate that, that acronym of I am safe, and that can be a way to help you kind of reviewing your own life and helping you find that those harder changes to get to that path of wellness.
Mm-hmm.
So many great comments. Susan, when you mentioned the I am safe, the primary application or concept there is in crisis, or is that kind of just a self-assessment of potential impairment?
I think that a lot of the content of this talk was more about when people are in crisis, and clearly the COVID pandemic for all of us is not a discrete. It's not like a plane crash that happened and you're dealing with trauma for 24 hours. It's obviously, this is an ongoing, it's an ongoing change in our environment that we have to kind of deal with. So I do think that some of this material is more designed for an acute crisis, but I think we really can apply this to general to our general coping mechanisms. So I think that was the original intent, but I think we can probably extrapolate some of this into the situation that we find ourselves in right now. Sorry, go ahead.
You mind if I interrupt? I just, so it's partly because I was kind of thinking of it as, that way. Like, I do think we're in crisis. I do think it's a broad crisis. I think, I don't know, like I'd almost share a little bit my last couple of months, but it's the complete recreation of an amazing rhythm that I was in. And the rhythm wasn't like I was, every day was like fantastic and, whatever, but it was pretty consistent of way more good days than bad days and pretty easy to redirect. And because I have learned a lot of the skills, I've been able to do it, but it's kind of like, hey, those may have worked really well in normal times of normal stress and normal difficult job. But this seems like I could go to work and most of the time know that my family was safe and things were pretty well. And now I carry that stress of that, people aren't getting educated, or people are like having their own little childhood emotional breakdowns and stuff. And it's like overwhelm, right?
Right.
And I think that it's interesting to me. I mean, I've tended to, for whatever reason, be really effective in avoiding the worst coping mechanisms. But I have some that fall into the negative category. And one of them is delving into work and doing more work, even though I'm already doing enough. Right. And so, I don't think that's all bad. Sometimes it can be very productive, but there's the drawn out nature of a lot of this, some aspects of that wearing on me. So I just think that you're highlighting so many things, whether people are visually looking at it as crisis because of the duration, or crisis because of maybe even something not related directly to COVID-19, just to its consequences, or who knows. It sounds like a great tool of just going down the checklist and say, yeah, consistently, I need to work a lot better on avoiding fatigue. And, I do pretty well with, I'm not one of those ER doctors that has to like pepper up and do like an amazing set of hours just continuously going. I do that in surgery, but I have trained myself to shut down a ton of my bodily functions for an incredible amount of time. And I don't know how I learned that, but I learned that. But if I had to go from patient to patient, that wouldn't work for me because I have one patient and one job and one focus when I'm doing an operation. It allows me to do that much better. I don't know. We each have kind of these interesting, unique challenges depending on our specialty or.
Right. I think so. And I think this is clearly, when I think about it, I think a lot of it is designed for, you think about emergency physicians specifically in an ED setting or primary care, like you said, I think it depends on the specialty, whether you can really apply this or not. And also the crisis at hand, whether it's something that's discrete or ongoing. One thing I did also get from this lecture that I thought was really a great thing, a great reminder, is this whole concept of nurture your network. And by that, I mean the whole concept of really looking out for your colleagues and really being in touch with how your colleagues are doing. Because I think some people do better than others with stress. And as you pointed out, I mean, some people actually flourish in these kind of situations. They work harder, they seem to be more productive. Other people just aren't really, tolerating the new situation as well. So having a buddy, so to speak, that you're kind of in touch with, that kind of keeps you social, you help to keep them socially accountable, and, somebody you can say, hey, what can I do to help you? Or, how are you doing? Just to kind of keep people engaged and know that there's other people out there that really care about how they're feeling and how they're doing, I think is really important.
Excellent.
I think one thing that hasn't been mentioned, I was wondering if F was going to be family. And so I think.
Yes, that's a good point. That's a great point.
Last session we had was we're all, have some concern. Are we going to bring an infection home to our family if we're, especially in the ED or some other, frontline position like that? Less so me as an orthopedist, but also just in terms of, what you brought up secondly was your network. Hopefully the most important node in your network is your family. And so I fortunately had the privilege of being home with them for 2 months. So that was wonderful from my end.
Right.
Never had that before, where 2 months I didn't have a trip, I didn't have to work, I didn't have to, spend with them.
Yep.
And I'm being challenged with the emotion of jealousy. I'm like with Greg, I'm like, I kind of like that job he's got up there. Maybe there's like another 10 days. I don't know. So what are other thoughts? What do people think are the stresses or the challenges to wellness that people are experiencing right now?
Well, I think you kind of talked about it earlier, Jeff, and that is your rhythm. So here's where a challenge is either, a challenge or an opportunity. If you're in a good rhythm, it's a challenge because, you're trying to maintain that. Whereas if you're in a bad rhythm, it's a nice opportunity to correct some of the things that you'd like to correct, because it really has turned so many things on their head that you can look at it differently and try a different approach. And you might find it's an opportunity for a better rhythm.
Excellent. So, Terry, you mind if and this is a little bit of potentially changing subjects. What what are you finding either with clients or with colleagues that you encounter? What are their challenges, and how do we help?
I think one of the challenges that I'm personally experiencing it, and in chatting with clients about it, I think it's connecting to the moment and really taking time to pause and recognize what you are experiencing in that moment. And Jeff, I think you chatted a little bit about the emotional aspect of it, and I think that that's part of what we as physicians don't tap into as much. It's most certainly not what I was taught, and quite honestly kind of taught to put the emotions aside, put them on the shelf, because there's not time to deal with this. You've got a busy clinic day, you've got back-to-back surgeries, you've got people who are asking you for advice and need decisions and need you to be fully focused on them. And so you're not fully focused in on your emotions and what's going on with you right now, as you're maybe coming out of one meeting or one OR that where things didn't go as well as you would have liked for them to go. And so you're angry, or you're frustrated, or you're disappointed, or you're just kind of in a frenzied state, and you walk out of that and go right into the next without giving yourself an opportunity to pause and take notice of what is happening inside of you at that moment, to really, ask, like, okay, or just to even recognize what am I feeling right now, and what is the emotion that's coming up for me right now. And yes, you may have to move immediately to the next thing, but you can take a moment to get in touch. And a moment doesn't have to be 30 minutes. It doesn't have to be a whole yoga class, or, it doesn't have to be stepping away and for minutes and minutes of meditation. If the situation affords itself for you to give that kind of time, then I think that's great. But I think there's so much that can even come from 60 seconds, from literally 60 seconds. And I think we all have 60 seconds to stop and pause and to really notice what's happening inside of you and around you. And Jeff, before you mentioned about going into kind of a shutdown mode from a bodily function perspective. And it's like, how did you get there? And I recall that. And what came up for me as you said that was, it came up for me, and I was able to move into that space from practice. That comes from practice. That comes from doing that, day after day after day. And that expectation maybe even being set for you to do that, or you set the expectation for yourself that I'm going to get through all of these things in this day. And in order to accomplish all of these things in a day, then I'm going to forego all of these other parts so that I can make sure that I accomplish all of the things that I set out to do today. And that's not giving yourself any self-care or any compassion or treating yourself with any kind of kindness. And so I have found a lot of times that it's even just reminding my clients, like, you have permission to take a moment and experience whatever emotion it is that you're having, and you don't have to apologize for that. Let's then dig deeper into why the emotion is coming up for you. What's the trigger behind it? But the emotion is not good or bad. The emotion is what you're having at that time. And so let's not negate it, and let's not try to cover it up, and let's not try to act like it doesn't exist.
Thank you, Terry. The definitely taking a moment. And what I find interesting is trying to describe what you were describing, where people attach an immediate time to something when we say, oh, you should take a break, or you should pause, or you should exercise, or whatever. And everybody all of a sudden attaches, I don't know, an hour or some time frame. And it's, wait, what if you didn't have to require a certain time? It just was any time, right?
Right.
I think it was a week ago, I was frazzled for, I don't know what reason. And I had a coaching call, and I have to confess, prior to this, even though I've been advertising sort of this Headspace thing, hadn't done Headspace. As like, I need 10 minutes. I gotta get myself into a better state before I jump on with a client. And I did it, and kind of true to form for me, it honestly probably took almost 7 or 8 minutes before it really probably had its intended effect. So had I done it shorter, not sure if it would have brought me into a space that would have helped, but I just, the effort probably would have. And so that was really helpful to me. And I, just from an email, it had some reminders. It had 3 choices. I go, which one do I want to do to get in the right mood for a client? And I picked it. So, but I think that there's all these options. There's all these practices. And, just for my journey, that hasn't been one that was at the top of the list. But it's nice to know that it's out there, and it did have some benefit. And it fits the concept of taking a moment.
I just wanted to respond to something that Terry had said about, putting emotions on the shelf. But I think the further I get into practice and the older I get, there's the difference between healing and curing. And I don't think you can heal a patient without getting emotionally involved in that, and I think it goes back to your earlier comment of, you don't miss clinical practice because you have the relationships. And there again, you can't have a relationship without some sort of emotional involvement. So we may be taught to put it on the shelf, but get them off the shelf, because they're the best thing. They're what's going to help you develop those relationships with your patients, with your clients, with it.
Yeah.
I was going to ask a similar question of the group related to motions, and I was looking at the panel, looking potentially the folks with us, that there's definitely an element of like-minded, and where we're trying to change a culture. But I can't remember exactly what you said, Terry, but it was this: we're not really allowed to have emotions. We're not really allowed to show them, something to that effect. And I don't think there's anyone on this webinar that would suggest that hasn't been part of what many of us were taught. We're in a group, I think, that are like aware that we need to allow them. We probably need to have a safe space. Maybe there's more appropriate. I mean, when I learn and appreciate emotional intelligence, there is some effectiveness to knowing when it's appropriate and when it's not, right?
Right.
And doesn't mean you have that level of control, but that is a higher level of dealing with it. But I guess my question is, for those that are out there that aren't as attuned to the importance of these things and how relevant it is to quality and patient care, why can't we get them to understand the importance of emotions, and that we should be creating safe spaces to share them?
So I think maybe I'll try to take a stab at this. And I think in part because emotions have been described as the fuzzy stuff, the soft skills, and the focus has been more on technical competency. which is the, you know, the harder stuff. If in contrast to emotions, if emotions are the soft and the fuzzy stuff, the squishy stuff, then the technical competency is the harder stuff. It's the really clinical skill set, and it's very easy to measure. And so there's a very, you know, tangible metric that you can put around it, and you can show improvement. You can show that your cost is going down. You can show your OR time is shorter. You can show your quality scores are better. So we have really, we have a dashboard that we can use to track and to monitor and to even, you know, compare doc A to doc B to doc C, and, you know, create a competitive environment where individuals are even feeling like they're vying against one another to be the top doc, which, you know, I think is like an arbitrary award that we kind of put out there, but you know, it's like, you're the top doc of what? You know, I mean, I think we're all top docs, you know, but it's like, well, I'm at the very tippy top of the top docs. So, and you know, I'm not quite sure what that goal is that you're striving for. But I think when it comes to the emotional aspect of it, there isn't a dashboard. There isn't a metric that we monitor on a regular basis, but it is very clear that when you look at teams where emotional intelligence is high, where you look at cultures where there is a safe space for individuals to express themselves, and to do so in a very healthy way, where they will be supported, and where there is supportive accountability, and where you can take risk, and where you know that you can experiment and you can innovate and you can be creative without being ostracized or without you being penalized, that those teams, those cultures, and those organizations do a lot better.
Mm-hmm.
But we don't put those at the top, and, you know, we don't make those teams and those organizations the gold standard, and the ones that we should, you know,
Mm-hmm.
try to understand better about what is it that makes them work. We sometimes then go in and start to dismantle the team and pluck out individuals that seem to stand out as, you know, well, you're a really strong leader, or you're at the top, so we want to take you from this team and move you over to this team and have you turn this new team into the team that you just came from. And that's attributing all of the efforts and the work of the team and the success of the team to that one person. And it was from the collective working together of that team that helped them to achieve that success. So instead, like, let's stop trying to make one person who might really excel in emotional intelligence, but let's not hold them up as the hero or as the savior and try to move them from group to group. But let's instead really look at what is it about a group that helps them to come together. And I think what we'll find is that that's where emotional intelligence is thriving, and where there's self-awareness, and where there's social awareness, and where there's self-management, and the team can discuss challenges that they're experiencing in a very open and supportive fashion.
Well, and to just build on that, Terry, a little bit, in terms of the individual physician, not even in a team, but I do think that being in touch with your emotions and really being honest about that, I really do feel that does lead to more of a sense of fulfillment and job satisfaction with your career. I mean, I know myself personally, so I've been, you know, I practiced emergency medicine for 25 years.
Mm-hmm.
And when I think about who I was as a physician when I was right out of residency, I was like you have alluded to, you know, the whole concept of being, just focused on the technique and the information and the knowledge, and not really spending much time like sitting down, talking to patients, getting in touch with your own emotions and your interactions with people. And through the years, I really evolved into someone that was much more in touch with my emotions, and therefore spent a lot more time with my patients. And really, I obviously the ER is, you don't have a long-term relationship with your patients, but the time that you are with them, taking that extra bit of making that extra bit of effort to really connect with someone on an emotional level made a huge difference. And I really felt that as I got older, sort of shifting the focus to more of that part of my practice rather than just the technical, just the facts and was so much more fulfilling for me. And I really do think that will help. And especially in the situation that we're in right now with the stress and anxiety of the pandemic situation, I think being able to be in touch with our emotions and allowing that to come into play in our practice, I think is a huge satisfier for people. And I would like to think that the physicians just coming out of residency are more in touch with the whole concept of wellness, and hopefully there will be a trend towards people improving their job satisfaction in medicine in general. And I think the emotional component of that is going to play a big part.
I think, Jeff, your original question is what's keeping others from bringing their emotions into the clinic or, in clinical situations?
Well, more just into the profession, that there's more and more data that high performance, optimal performance comes from recognizing and applying emotional management, best practices, that the suppression of emotions, which is what I was taught, and some of what I taught myself to think that way. So it's not like I'm taking that all on everyone else's responsibility, but that mechanism isn't as healthy. It isn't as sustainable by tons of the science. So why do we continue to do what the science says it is actually not beneficial?
I think the answer is, or at least part of the answer is, to have a relationship with someone, to have, and emotions are part of that, you have to make yourself vulnerable. And I think that's really uncomfortable. And especially in patients, I can't imagine the ER. I mean, you've never seen them before. You've been 10, 15 minutes with them, whatever. And, relationships are built on trust. And so establishing that trust, being emotionally vulnerable in a short time frame is challenging, to say the least. And so and sometimes you get burned. And so
Sure.
I think that's
Right.
part of the reason that it's like, I can be a great surgeon, I can know all the evidence, I can tell them the proper treatment, and that's what I'm getting paid to do, and so that's what I'm going to do. And I don't want to risk the other side. My initial comment was going to be, I forgot to say I've got a PhD in engineering. So between being an engineer and a surgeon, I don't think you really want me involved in this conversation. But anyway.
Well, so the other thing that I would add is that I think that as you have the capacity to develop a really good relationship with a patient, I think there's the bigger picture of the career and your day and your fulfillment and satisfaction that even when we're not in front of patients, I just think that there's an opportunity to appreciate that, whether it's sort of pre-surgical game, pre-shift game, where you get yourself in the right space. And that includes, okay, I had a bad night's sleep. What am I going to do to acknowledge that and then address it? I I'm angry right now, but
Mhm.
I can't just go to the gym and work out right now. How do I process it in a relative, pretty healthy manner enough that you can still maintain performance for whatever you have to do? So again, I just think it's super interesting. I think people are doing it. I think if you're actually appreciating that you're doing it, you become more effective. And that's the concept of deliberate practice. If you're aware of, if you take the look that Susan said, you step out of the body and look down, that really allows you to sort of say, hey, what are you going to do? How can you help? And then you become your own advisor instead of needing somebody else to advise you when they don't even know all the circumstances. So it's a great method of self-coaching, and processing that. And again, it doesn't mean that you've finished, but at least you're doing the next best thing. I mean, I like the sports analogies where, if you throw the pitch that somebody hits a home run, but it was a good pitch and you're like, nice hit, like that's a good batter. What am I going to do? But if you kind of flubbed on it, right? You knew it didn't go the way you wanted to, and it goes out of the park. You're like, it's me. Like I totally threw the wrong pitch, but you have to move on. Right. And I just think there's so many emotional ups and downs in a typical day that maybe it's not tremendously unhealthy to say, okay, well, that patient made me mad, or that patient made me happy, or that patient, encounter did this, or my staff did that, and just suppress it all. It does work. I've done it, but I don't know if it's that healthy. And if there are better tools, better things that we could be teaching that would make me be on my A game or be in my rhythm more often, I think those are helpful to share. We do have a question from one of our attendees as to if any of us are still teaching residents. Greg, are you still involved in teaching of residents?
I keep trying. I actually have a resident this next 9 days or whatever. There is a rural family practice residency program here in Williston. So one of the residents was with me starting today. So
awesome.
So and when I was in Tacoma, I didn't have residents, but I started volunteering at a kind of a critical access federally funded clinic, and I was working with nurse practitioner residents at that program. So I keep trying. I love it. It's one of the more, I think it's like coaching. I mean, it's just very satisfying.
Mm-hmm. Mm-hmm.
Susan?
Well, I have retired now, so I'm not working, but up until last year when I was working, we do have residents that rotate through the ED and would have brand new mid-levels, both physician assistants and nurse practitioners coming through. So yes, we were doing training, and actually first year interns, going into family practice or whatever would rotate through the ED. So yes, and it was very satisfying because I think by and large residents are, they're just so enthusiastic and they really want to learn stuff. So it was very enjoyable. I really liked it.
And Terry, I know you've shifted quite a bit. Do you still have opportunities where you get to teach residents?
No, I don't. And that was one of the things that I did love to do was teaching others. And in my practice, we had one of our nurses even become a nurse midwife. So that was, she was a nurse midwife in training. That was great working directly with her, and and just getting to see through somebody else's eyes, what it's like to experience the whole clinical the whole clinical aspect. And I think it, it helps you even up your game as well too, is you start to have to really think about, okay, well, why do I do this? Like, why do I use this particular suture? Or why am I using these instruments? Or, why do I choose to go through my H&P in this kind of format? So I'm not working with residents now. I know that was ultimately the question. This was a long roundabout way to say no, but I did love working with residents.
Well, I get to teach fellows, and so they're just a little bit more senior resident, in my opinion. But it's that ability to have an impact on the next generation. I think a lot of us see that in the coaching that many of us do, where you feel that you have an impact beyond your client. And I think same thing in teaching residents, that you feel like you're really having an opportunity to positively influence a trainee.
Mm-hmm.
And then I do know that Amanda, I can't remember if Amanda's a residency director or just very actively involved in resident teaching, but she's a huge resident advocate. I know that. So I guess we have gotten to the hour. I'll just shift to kind of asking people if they have, if anyone in the audience has any additional questions for our panel. And then I would also see if each of our panelists would be willing to just share a closing statement. Seeing no additional questions, who wants to jump off first for a closing statement from our great panel? All right. If you weren't good, I'm going to let Greg go, but Terry does a great wheel thing, and I'd pull out the wheel if I had to. So go ahead, Greg.
I was just going to say, if you're interested in doing some reading on vulnerability, Brené Brown is a great author. So
Excellent. Susan?
So thank you so much for inviting me to participate today. This was really great. And I just want to say to all of the people out there that are listening that I hope that you all are feeling that you're coping okay, and that you're finding ways to keep yourself sane during this crazy time. So thanks again for having me.
Thank you. And Terry?
I'll definitely echo Susan's thoughts around thank you for the invitation. Thank you for the opportunity to participate in this. And I do hope that all of us do continue to extend the same level of compassion that we do to our patients, to ourselves, because self-care is so critically important. And not just now, but even when we do move beyond COVID-19, we need to continue to take care of ourselves and focus on our own wellness. And I think, kind of going back to the point I made a little earlier about connecting to the moment, is maybe a challenge that I would give to all of us. And I am fully going to partake in this as well, is what is your intention for the present moment? And, just ask yourself what's your intention. And I think that can really help you in moving forward.
Great comment. Thank you so much. And thanks to all of the panel. I'll just make a couple announcements on our closing, that we're continuing to do yoga to the surgeons each Sunday. For me, it's 5 p.m. Pacific. And then you can correlate your time zone. We seem to, for whatever reason, leave out those poor folks in the mountain time and Arizona time. Zonies always figure it out themselves. It's so great. Like, they don't even care. Just give me a time. I'll tell you what time it is. Everyone else is like, what time is it? And then
You have figured out how we think. Thank you for that, Jeff.
it's amazing. And then, so that's each Sunday night. And then we have our position coach training info sessions that we're doing on Monday and Thursday afternoons. And then our module 2 and module 3 of our physician coach training, where you can go through our stuff, where we're doing it as just, you can sign up for one module and just do it for the learning and topics that we're discussing, but there's also practice coaching opportunities. So it's a really fun interactional experience. And some folks are signed up for all 8 modules so that they can eventually qualify for ICF coaching certification. But they're fun topics, and we've been having a blast. We have a great group, but we're adding people, and because surgeons have crazy schedules, we're going to lose people here and there on certain dates, because that's just the way our lives work. But they'll be able to make up that time eventually if they're looking for a certification. So those are my announcements. I will go ahead and just encourage on our point that we're certainly huge advocates for surgeon wellness, and look forward to opportunities where we can move forward together. Take care, everybody.
Thank you. Take care.
Good night.
Good night, everyone.
Bye-bye.
Good night. Bye-bye.